Good evening, everyone, and thank you for joining us for tonight's Central Jersey Regional Public Hearing. Before we begin, because there may be some confusion and I may have not been clear yesterday, but this is just the first round of regional public hearings that we're going to be hosting. This session, we understand and we relayed yesterday, given the fact that the League of Municipalities has a major statewide event and there's a national event in Las Vegas. We are going to have more hearings, likely in January, and more details will be forthcoming. But we did just want to reiterate that and make that clear before we begin. But we do thank those who are on tonight's call, and we're looking forward to hearing what you have to share this evening. My name is Charles Barker, and joining me tonight will be Commissioner Krista Nash. Just a quick housekeeping update. Commissioner Nash is on vocal rest and continues to recover. So she's going to do her best to share with us this evening, but she is going to do so likely in closing remarks. And we thank you in advance for your understanding. Next slide, please. And so some of you on the call may be joining us again. Others may be here for the first time. And so we just want to remind you of the purpose of the regional public hearings. The purpose is to hear from you. Again, the cannabis industry has been generating billions of dollars in tax revenue, and we're hopeful that it's going to generate a significant amount of revenue here in New Jersey. And with that said, we want to be mindful of how you want that tax revenue to be spent. Again, we legalize cannabis to right the wrongs of the fair war on drugs. And we want to hear from you on how that is to be done. And so you're likely to hear from us briefly, Commissioner Nash briefly, myself, and Executive Director Brown. But the majority of the conversation is for you. So we can hear from you, so we can listen to you. And then so we can incorporate that into a recommendation report that we would share with the governor and legislature, which we'll go into a little bit more detail about a little bit later. And so with that said, I'm going to briefly turn the program over to Executive Director Jeff Brown, who's going to give a few remarks.
Thank you, Commissioner Barker, and thank you, Commissioner Nash. Thanks to the CRC staff for helping to put this on, and those members of the public who are joining us tonight to share input on this critically important topic. The CRC, our goal is really to establish and grow a responsible, regulated medicinal and recreational cannabis industry here in New Jersey. We do that by applying our values of safety and equity, and we really focus on centering our work around protecting access for patients, the production of safe products, and promoting diversity and inclusion in our industry, but also making sure that the cannabis industry and its effects on New Jersey ultimately improve equity across the state. And at our last commission meeting, I spoke about how, by estimates in other states and, what we look at here, at most probably 15% of adults in New Jersey are going to use legal cannabis. But, it's relevant to everybody, and it's relevant to everybody because it's going to raise tax revenue for the state. It's going to raise tax dollars that can be invested in repairing communities that have been impacted by the criminalization of marijuana in the past, as well as other initiatives, particularly focused on impact zones. And Commissioner Barker is going to talk about what the statute does and requires us to do. And it's already doing that. At the last commission meeting, the CRC voted to make a recommendation to fund the Business Action Center to create a free technical assistance program for aspiring entrepreneurs who want to get into this industry, including people who want to transition from the legacy market to the legal market. This is a first in the nation initiative, and a critical one, and that's $1.9 million in tax revenue being invested to do that. In the last quarter of last fiscal year, the Social Equity Excise Fee raised just over $200,000. And so that money is going towards that technical assistance program, as well as additional tax revenue. So, the goal of these hearings is to really hear from you as the tax revenue continues to accrue. What should be done with it? How should it be invested? How should it be used to improve communities? So thank you again to Commissioner Barker, Commissioner Nash, the staff who are here putting this on, and all the members of the public who have joined us.
Well said, Director Brown, and thank you on that last point. I'd be remiss if I didn't thank our public education and engagement team and staff who are critical in helping us put on these public hearings and communicate with you. And before we briefly turn it over to you, I just want to go over a little bit of background overview of the statutory provisions that underlie the hearing protocol that we're under. And next slide, please. And so the statute requires us to host at least 3 regional public hearings. And so if I wasn't clear, this is the first round of hearings for this session. But again, we may be having more hearings in January with details to come. Last session, we had hearings in March. It was March 2nd, March 9th, and March 16th. You can stay on that slide. After the hearings, the CRC is charged with reviewing the data and then drafting a recommendation report for the governor and the legislature to review so that they can understand the recommendations based on your public comments. And the legislature is charged with providing the CRC with a list of recommendations based on that report. Next slide, please. And so before you, we just wanted to present some of the common themes and some of the frequently heard remarks that the public really relayed to us during our last sessions. And so not surprisingly, economic development and justice reinvestment topped the list. As Director Brown alluded to, we heard the public and we have committed a significant amount of tax revenue to the New Jersey Business Action Center, which is creating literally a first-of-the-kind program free of charge, providing technical assistance, training, business development, and incorporating legacy operators because we know how critical they are to advancing the cannabis industry. We definitely heard you when you said that money should not be committed to law enforcement, and we included that in the report. Next slide, please. Additionally, public health, really gearing into mental health services, substance abuse services, overall harm reduction and general healthcare services. That was addressed in the report and was another common theme, as was workforce development and focusing on youth education and youth safety. And so we just wanted to reflect that and remind you that we did put your comments in the report, and that's why it is critical for you all to share with us during this round of sessions, be it today, tomorrow, or come January, because we definitely want to hear from you and incorporate your genuine concerns so we can share that with the governor and the legislature. Next slide, please. And so just a quick recap. Governor Murphy signed the CREAM Act into law February 2021. And so we've been operating just over 18 months. And in that time, I do want to emphasize, and I think it's critical as we see the different types of licenses before us, the upcoming revised rules should expand upon the license classes. And so when we talk about wholesalers, distributors, and delivery licenses and operations being onboarded into the cannabis industry here in New Jersey, it creates, as Director Brown said, another opportunity for even more revenue to be generated and committed for social equity purposes. And with that said, we just wanted to emphasize our commitment to equity and to social justice by reminding the public of the tools that were created to show how the CRC is committed to social equity. Next slide, please. We definitely wanted to share some market updates. And so as of our latest tally, the CRC has issued over 800 licenses based on 1,300 applications received. And so staff is really doing their best to work through the applications. Third quarter tax revenue is highlighted here, over $7.7 million. I think in total between April and September, the CRC has generated about $11.9 million in tax revenue. Our total SEAF numbers, I know Director Brown alluded to last quarter of the fiscal year, updated social equity excise fee numbers are being tabulated now, and we should have more details in the near future for you. But we do want to emphasize that with the onboarding of, or with the expansion now of conditional conversion awards and annual awards, and then with the ability of medicinal ATC operators to expand into recreational, into personal use sales, we are excited and hopeful that this would generate even more tax revenue, again, that can be committed to social equity. And so, fair question, many of you may be asking, where does that money go? And so the money goes into the CREAM Fund, which was created by statute, and where almost all tax revenue that is generated is deposited. Next slide, please. Some of the statutory requirements, some of the provisions that the legislature shall be guided by when allocating the money are before you. We do want to highlight a major provision that at least 70% of all tax revenue, at least 70% of all tax revenue shall be committed and used for investments in impact zones. And the legislature created and designated impact zones to reflect historically devastated communities that were hardest hit or that were impacted by the failed war on drugs. And so we do just want to ensure that the hardest hit communities that are included in the impact zone designation are prioritized. Importantly, 15% is committed for the Underage Deterrence and Prevention Fund, which is geared and focuses on our commitment to providing safety and education for our youth. Creatively, money can be used to provide direct financial assistance to qualifying persons. And so when we think of universal basic income programs or other creative ways to provide those in need with assistance, the legislature has the ability to allocate money in that way. And so we're excited to see what the legislature has in store as we continue to generate revenue through cannabis tax sales. Next slide, please. And so not only is the CRC guided by social equity rules and provisions, but the statute provided the commission with the option to establish a social equity excise fee, which we definitely did in our commitment to establishing an equitable and inclusive marketplace here in New Jersey. We thought it was imperative to establish the fee. The fee is imposed on cannabis cultivators in the personal use market, not on medicinal cultivators, and it's on the sale of usable cannabis to any other cannabis establishment other than cannabis cultivators. Next slide, please. The fee is 1/3 of 1% of the state retail price per ounce. Last year, based on the average price per ounce of, I believe, $323 roughly, the excise fee was $1.10, which it currently still is. The CRC recently voted to increase that fee based on our latest numbers, which reflect, I believe, as of August 1st, that the average price of cannabis here in New Jersey is roughly $455. And so incorporating that formula, we have a new excise fee for 2023 that will be $1.52 per ounce. the CRC does have the flexibility to increase or decrease the fee based on market need and demand. And so that is critical for us to be able to monitor the market and adjust accordingly. Next slide, please. And so as with the majority of all tax revenue, social equity excise fees are to be used for social equity investments. And before you are just some program examples. We highlighted some of these during our last sessions, and we are excited to see from March until now, November 2022, we have seen programs be established here in New Jersey. Again, not to belabor the point, but Director Brown touched on how New Jersey now has a first of its kind in the nation, technical assistance program. We have apprenticeship programs, business development, consulting service programs that have been developed. We have financial assistance and different other housing development initiatives being developed. We talked about nationally, Evanston, Illinois, which created a national model for thinking creatively about how cannabis tax revenue can be used to right the wrongs of the failed war on drugs. In Evanston, Illinois, they used the cannabis tax revenue to create a home ownership program. And if it's one thing we know about wealth, one of the greatest transfers of wealth is through home ownership. And so to be able to layer on those equity considerations through cannabis tax revenue is critical. And so we just wanted to provide some examples for the public to encourage you. Again, here are some more. We've seen legal aid services really step up. We've seen educational support services be developed. A lot of our universities are developing curriculums. And so we're excited about that. Mental health services. I was just reminded of a traumatic story of a individual who relayed how their first experience with the failed war on drugs and how it critically impacted them was seeing their father hold the door as the police were trying to break in. As the father moved back, the police bust through the door. The gentleman was shot. The house was ransacked. And the individual tells a story of how they were a child and just watched all of this whole episode that, may have been minutes, but seemingly was hours. And this is just one of many stories that individuals go through, that families go through, that communities go through. There was trauma, intentionally induced or not, that continues to still impact communities. And so, it's critical that those services are provided for. And so we just want to share these things, some of these examples for you, to inspire you and to encourage you to share your thoughts, to be motivated, to share what you envision, and to let us know how cannabis tax revenue should be spent. And so with that said, I'm going to turn the program over briefly to our Director of Communications, Ms. Tony Ann Blake, who will go over protocol for the public comment period.
Good evening, everyone. Thank you for joining us. The public comment period will go for as long as there are folks who are here to comment. We will start with those who have registered to speak. 3-minute limit. Of course, be mindful of others here, be respectful and concise. And if you can, have one person from your organization represent the entire group. I will call out the name, and as soon as you hear your name, please raise your hand in the chat so that I can find you there.
Tony, before we begin, you just touched on something, and if it's okay, can I just make one point?
Go ahead.
Director Blake made a critical point about speaking on behalf of a group and how critical that is. Yesterday, we had a small quantity of numbers, but we had strong quality of comments. And I say that because we had a representative from the United Black Agenda, which reflects a collective of civil rights organizations here in New Jersey, and the NAACP, National Action Network, Legislative Black Caucus, and New Jersey Institute of Social Justice, Salvation and Social Justice. SANS J. I mean, I could go on, and so it is important if you are representing the group to let us know that, because that impact is massive. And so, thank you.
Thank you, Commissioner Barker. Kendall Small. Kendall Small, if you're here, just raise your hand and then. No. Joshua Alb. Joshua Alb. Kendall Small. Sorry. Marlena Ubel. Marlena Ubel. Go ahead, Marlena. Marlena? I think we just lost Marlena. I'm
No.
not sure. Go ahead.
Okay, sorry. Getting used to being promoted to panelist. Thank you. Good evening. Thank you for this opportunity to share my testimony. My name is Marlena Ubel, and I'm a policy analyst at New Jersey Policy Perspective, a nonpartisan think tank focused on advancing economic, social, and racial justice for New Jersey residents. I want to start by thanking you so much for your recommendations from last year. It's clear that you heard the call to make sure that the money from the Social Equity Excise Fee be distributed not just back to municipalities, but into communities harmed by the war on drugs and not spent on law enforcement. As you know, the language surrounding the use of this revenue is vague, allowing municipalities to exercise tremendous discretion. Therefore, there must be very clear parameters on what is acceptable and what is not, along with the expectation that a participatory budgeting process be followed. This is of utmost importance because the communities and the individuals who have been directly impacted by the drug war must have meaningful input on how the money is used. Meaningful input also requires transparency. The public should have access to how much revenue is raised and where that revenue is going. This should not be a slush fund, nor should it be spent on coercive treatment, school resource officers, or otherwise invested in punitive measures connected to the criminal legal system. This is the very entity that caused the most harm enforcing cannabis prohibition. As you outlined in your prior recommendations, revenue from the Social Equity Excise Fee should go directly toward promoting stronger, safer, and more resilient communities, as well as services that recognize substance use as a matter of public health. Examples of such investments include recreation and community programming, harm reduction services, neighborhood restoration, after-school programming, and vouchers or direct payments for individual needs, such as utilities, rent, or medical costs. New Jersey's municipalities have an obligation to equitably invest this revenue, meaning they must center racial justice and reparations for people harmed by the war on drugs. Anything less would fail the very communities and residents that the Social Equity Excise Fee is intended to support. Thank you so much. And if I may make a suggestion for next time, if you could email the link to the Zoom or a confirmation after registering to testify, I think it would make it so much easier to figure out how to connect to the meeting. Thank you again. Thank you so much.
Thank you. Next up is Ami Kachalia. Ami spoke last night, so maybe she's not here. Okay. Raquel Romans Henry. Go ahead, Raquel.
Thank you, and good evening. Good evening, Commissioner Barker and Nash. Thank you for the opportunity to testify today and for your thoughtful and thorough recommendations last year. My name is Raquel Romans Henry. I'm the Policy Director at Salvation and Social Justice. And for years, we as an organization has fought vigorously alongside partners to end the failed war on drugs in New Jersey. Ending cannabis prohibition was but one step in a marathon for justice. Reparations is the other. We cannot begin taking steps towards repair unless we literally put our money where our mouths are. And that means making significant and intentional investments to address the harms suffered by Black communities by the hands of the state and draconian and quite frankly, racist policies. Now those investments have been, some of them have been highlighted, restorative justice and violence interruption hubs, community-led first response pilot programs, community resource programs, housing and building of equity, investments in guaranteed income programs, education, and Black maternal health are just a few. Now I'm mindful of the time, so I'd like to expound on just 4 areas in particular. First, regarding violence interruption, harm reduction, and restorative justice hubs. We know that a significant part of maintaining the safety of Black community involves limiting interaction between law enforcement and those communities. Violence interruption programs and restorative justice hubs have proven to be both effective and preventative mechanisms by which residents are kept safe and are not siphoned through a carceral system. So we encourage funds to be used in that space. We also secondly, we are calling for investments to establish community-led first response pilot programs that would serve as an alternative to law enforcement response for nonviolent substance use, behavioral, and mental health calls. Like violence interruption, harm reduction, and restorative justice hubs, the presence of community response teams have proven to be more effective in violence interruption, limiting unnecessary and harmful interactions between police and Black communities. It cannot be overstated that these funds should not be used to further fund police or law enforcement agencies. Third, we're calling for investments in Black maternal health centers. New Jersey has the 4th highest maternal mortality rate in the nation, with Black women being 7 times more likely than white women to die before or after they've given birth, and Black babies 3 times more likely to die than white babies before reaching their first birthday. Given the dire situation in the state, there needs to be a significant investment in ensuring that there are direct services available to Black mothers in cities like Trenton and Plainfield that have really turned into birthing deserts. Fourth, I'd like to discuss the issue of Black wealth, more specifically how the war on drugs has extracted generational wealth from families and entire communities. So we recommend investing those cannabis dollars into a guaranteed income payment program, which would offer unconditional payments to individuals to help support themselves and their families. Again, I'm mindful of the time, so I'm going to close on that note.
Go ahead, it's fine. Go ahead.
Okay. You know, we know about the $300,000 racial wealth gap that exists in the state. So we are recommending that the state direct cannabis revenue towards establishing guaranteed income pilot programs. And these programs would, again, provide recurring unconditional cash payments to individuals so they can support themselves and their families. And we know that guaranteed income programs have been proven to be an effective way of reducing the racial wealth gap and increasing equity. So I want to thank the commission for the work that you guys have done thus far and for the recommendations you've offered. I look forward to seeing further engagement with the community to ensure that the investments of these funds reflect the promises that have been made and upholds the integrity of the legislation that so many advocates and community stakeholders fought so hard to see passed. Thank you, and I yield my time. Good evening.
Thank you. Next up is Reverend Charles F. Boyer of the Greater Mount Zion AME Church. Go ahead, Reverend.
Thank you so much. For one, thank you to Commissioner Barker and to all of the commissioners and everyone involved with the CRC for holding these public hearings. You can basically, I'm gonna go real quick. You can basically copy and paste everything that Rochelle said. I'm here in my capacity as a pastor in Trenton, in one of the most impoverished areas of the city. And I just want to emphasize, you know, everything that Raquel and Marlena put forth, but specifically from the context of Trenton, since this is the central New Jersey piece. And for a couple of reasons. One, Trenton is the state capital. And at the same time, where we have the Gold Dome and all of that power, we stand in the shadow of that Gold Dome with some of the highest poverty rates and violence in the state. Particularly, it is critically important that these kind of investments be made in actual impact zones and that areas which do not suffer the same kind of poverty do not get these kind of dollars. So one, I'm here advocating for Trenton. And second, I am here advocating that when these dollars come through, that Black and Brown-led organizations are prioritized, and that we do not continue structural racism by filtering dollars to pretty much white legacy organizations and just shift structural racism from one space to another. And so making sure that community-led, particularly Black and Brown community-led organizations are prioritized, since it was Black and Brown folks that suffered the most marginalization at the hand of these policies. And so again, community-led first response, restorative justice hubs, birthing deserts, of which Trenton is a huge one, moving people from renters to homeowners, workforce development, and guaranteed income pilots. Thank you so much for your time. God bless you all.
Thank you. Anna Pazmino. Anna Pazmino, if you're here, raise your hand. No. Benjamin Guy. Benjamin Guy. Willie Dwayne Francois III. Willie Dwayne Francois III. Jessica Marie Vellers. Go ahead. Go ahead, Jessica.
Thank you. Good evening. Thank you for the opportunity to speak today. I'm Jessie Marie Biller, CEO and co-founder of Cannabis Equity Employment and a conditional license holder of Baked by the River Dispensary. I greatly appreciate that the Commission continues to hold these regional hearings to get input from the public on how cannabis legislation should be implemented here in New Jersey. I'm continually impressed by how receptive the Commission has been to public comment and feedback, and think that community input is especially important for tonight's topic: how cannabis tax revenue should be used to promote social equity. I hope to see cannabis tax revenue used first and foremost to address the damages done by the racist war on drugs. It is not just to have cannabis businesses making profit from growing and selling cannabis when people in our state are still facing the consequences for having done the same. It is a moral imperative to use tax revenue to provide reparations to those who have been harmed by cannabis prohibition. I believe cannabis tax revenue should be used to benefit the individuals directly harmed by cannabis prohibition and the communities hardest hit by drug war policing. Part of this could be through supporting community organizations, workforce development programs, nonprofits, and reentry programs throughout the state that are already set up to support this mission. Another part of this could be providing loans directly to licensed applicants and conditional license recipients who qualify as social equity applicants. The state cannot undo the harm done through the years of drug war enforcement, but it has the opportunity to use the tax revenue from this industry to do right by the individuals hardest hit. I would also like to see cannabis tax revenue used to fund harm reduction programs, mental health programs, and community response teams, especially in impact zones. Investing in these types of programs instead of law enforcement will help to support communities that have been harmed by unjust enforcement of the war on drugs. Thank you so much for your time. I hope you continue holding these regional hearings. Again, I really appreciate the opportunity to have public input.
Thank you, Jessie. Elise Richards. Elise Richards. Louis O'Delahose. Louis Delahaz. Cord Schlubben. Stacy Muma. William Rivera. Tiffany Fisher. Joanne Zito. Daniel Alexander Levine. Go ahead, Daniel.
Yes, hello, can you hear me?
We can hear you.
Hello, my name is Daniel Alexander Levine. Thank you for allowing me to speak. I'd like to say thanks to the members of the CRC who are here hosting the meeting, and also the speakers who have come before me, who have all made excellent points that I concur with almost fully. Thank you. A little bit about me is I'm born and raised here in New Jersey, Middlesex and Monmouth County, Middlesex County College graduate, Rutgers graduate. I discovered marijuana had tremendous medical value for me when I was about 17, and had been using it that way ever since. After I graduated Rutgers, I ended up in Northern California, going to graduate school for political science in an area that was Chico Butte County area, a very popular area for medical cannabis cultivation. And I found myself living there, involved in the medical cannabis for almost 8 years until 2018, when I was burnt out in one of the horrible forest fires there. And I've been living back in New Jersey since. I want to say that this is, I guess, technically the second time that I've been at a meeting through Zoom now with the CRC. I was very surprised that earlier today, the New Jersey Commission on Native American Affairs had their bi-monthly meeting, and 3 members of the CRC were there to give a lovely presentation. Jeff Brown, Mr. Wesley McWhite, and Glenn Walker. And that was just a wonderful experience. I myself am a member of the Citizen Potawatomi Nation through my grandmother, who came to New Jersey in 1967. That's a little about myself. I'd like now to address my comments to funding. It is Native American Heritage Month this month, and the thing that I would really like to see happen in New Jersey and everywhere is a massive investment in home gardening, organic gardening. We don't do it anymore as a society here in America. It is the most therapeutic thing you can do, is grow your own food with your family, with your neighbors in your community. The price of fuel now is outrageous. Not only is the price to get to the food store or the farmer's market outrageous, the price of food is skyrocketing. Now more than ever as a society, I feel we need to come back to home gardening, the tenets of organic gardening. We are unfortunately causing a health crisis around the world for animal and human life with the overuse of pesticides. So if we could see some of these cannabis funds in New Jersey used for not only the youth, but for home gardening, organic gardening, education and promotion, whether it be in the schools, etc., I think that would be a huge thing. We are the garden state. I was blessed to have been taught how to garden by my mother and my grandmother, and what I learned from them of how to grow some food, I was able then to learn when I began to get into the cannabis industry and medical cannabis. And what you learn from growing food, you can apply to growing cannabis and virtually any other plant. So that is something I'd really like to see. And also, I would just mention planting trees. We're losing a lot of good old trees here in New Jersey right now to age and disease and development, oak trees, maple trees. I think that cannabis taxation, if we could put a little bit towards replanting trees and making sure we protect our trees, which are our friends, that would be a wonderful thing. So I plan to attend many more of these meetings in the future, and thank you for having me. And Gazemnado, Great Spirit bless, God bless. Thank you very much.
Thank you. Commissioners, that was our last registered speaker. At this time, I'd like to invite anyone who may not have registered but would like to speak on the record. Patricia, go ahead.
Good evening. My name is Patricia A. Patton, and I am the founder of the Cannabis Business Alliances, headquartered here in Asbury Park, New Jersey. We are an ancillary B2B community at the intersection of health and wellness. Our goal is really to create opportunities for the membership, which are non-plant touching members. I wanted to just state that while I think the focus primarily, a lot of the focus is on license holders, and there's definitely good reason for that. I think though that the greatest number of opportunities really exist in real life for people where licenses are not required in the ancillary area. So to that point, I want to just make one little suggestion, and that is in thinking about who the hardest hit are, there is the category of underage, but there really is no recognition of older entrepreneurs. And so I would just like to suggest that they be included as a category as well. Thank you to the commissioner and to the committee for the opportunity to share my opinion.
Thank you, Patricia. Is there any present who may not have registered but would like to speak on the record? Just raise your hand and I will invite you to speak. Commissioners, there does not seem to be anyone else to speak.
Thank you, Director Blake. Thank you to all of the participants who shared their remarks. We heard some quality remarks. And so we're looking forward to closing this out strong tomorrow with our North Jersey call. And with that said, I'm going to turn it over to Commissioner Nash to close us out.
Thank you, Commissioner Barker, and thank you all for joining us here tonight. It is really refreshing to hear such unique and important ideas for investments. Before I started with the commission, I ran a reentry program that offered supportive housing for people who struggled with co-occurring disorders. And when I was appointed a commissioner, I wondered how my social work background would translate to this role. And as I sit here tonight and listen to all of you speak and offer up such important ideas, it makes me proud to sit here and recognize that unfortunately, there is still a need. There's not enough money for mental health and harm reduction and reentry services. And I'm hearing that again tonight, as we heard back in March. And that's music to my ears to be able to record this in a report and make these recommendations to the legislature and governor on your behalf. I think that's social work in an essence. So it's an honor to serve you, and we really thank you for being here tonight. These monies do need to go, these social equity excise fees need to go towards communities that have been harmed, and that's what we hope to accomplish tonight. So thank you again, Commissioner Barker.
He's very well said, Commissioner Nash. Again, public, thank you. I do want to reiterate, because it is important, it is an honor to serve you and work on your behalf. Please continue to come to the table, continue to let your voices be heard at our meetings. And we hope